Good afternoon and welcome. I'm Dr. Woodrow Myers. I'm the Chief Medical Officer and Chief Healthcare Strategist for Blue Cross Blue Shield of Arizona. And as a physician and a former health commissioner, I know firsthand the power of a community coming together to tackle tough health issues. One of today's toughest issues is the misuse of opioids and other substances. The alarming rate at which this epidemic is impacting lives and destroying communities is devastating. To announce how Blue Cross Blue Shield of Arizona is taking action, I have the privilege of introducing you to our President and CEO, Pam Cahaley. She may be new to Arizona, but she has been a change maker in the healthcare industry for decades. Pam was a driving force behind Vivity, the first joint venture in the United States between an insurer and 7 hospital systems to align financial incentives behind better healthcare outcomes. She was also a leader in Patient Safety First, a National Health Institute award-winning collaboration. Under Pam's leadership, we are sharpening our focus on improving the health of Arizonans and reinforcing that focus with our financial resources and our intellectual capacity. We're starting by turning the tide against the opioid epidemic. Please join me in welcoming Pam to the stage.
Thank you. Before we get started, I would be remiss if I did not recognize Dr. Myers. I call him the architect of this program. I feel so fortunate to be working alongside of him. He's inspired all of us with the vision about how we can work to save lives in Arizona. This program is launching today because of Dr. Myers and his talented team, including Dr. White, Dr. Wiggs, and Tiffany Dewart. Many thanks to Dr. Myers. So welcome to Blue Cross Blue Shield of Arizona. So happy to see you all here. Thank you to the governor for being here. Our board of directors is here. The advisory committee to the initiative is here, along with distinguished guests and the press. So thank you so much for being here. Opioid and substance abuse has been an increasingly important topic nationally and here in Arizona. And while this epidemic is all over the news, it's not just the headlines that get our attention. It's the impact that addiction has on the lives of our friends, our families, and our coworkers. The number 4 may seem small, may seem insignificant, but when I tell you that on average 4 people die every day in Arizona as a result of opioid overdose, it becomes a devastating number with a startling significance. Every day, the Arizona Department of Health Services tracks the number of suspected opioid overdoses, the deaths, and the babies born with withdrawal symptoms. Every day, that number goes up. There are people and those who love them behind these numbers, with stories of loss and fear. But hope is stronger than fear. It is with this hope we launch our new initiative, Mobilize AZ. I'm pleased to announce, through Mobilize AZ and in support of families across Arizona, Blue Cross Blue Shield of Arizona is investing $10 million to address the misuse of opioids and other substances. Our $10 million contribution is an extension of the state's $10 million investment in the Opioid Action Plan. Governor Ducey and our state leadership has set the stage with a financial commitment and important changes to the law. Inspired by this dedicated leadership, we're taking action, and we hope it inspires others to join as well. True to our mission to improve the quality of life for Arizonans, Mobilize AZ will tackle specific health issues Arizona is facing. Beginning with substance use disorder, we'll be investing brain power and financial resources for the health and future of our state. We named our portfolio of public health initiatives Mobilize AZ to reflect the strength we have when we mobilize to work together to improve health. We believe it will take us all. It will take insurers, doctors, employers, government, regulators, and the community standing together to save lives and truly make an impact. Our areas of focus with each of those, with the state of Arizona, are prevention, treatment, and recovery. For example, launching today through Mobilize AZ is a grant program encouraging innovation, education, and improved access to treatment. We will award millions of dollars to Arizona organizations and academic institutions to support their work related to opioid and substance use prevention, treatment, and recovery. Already, funds have gone to expand the supply of naloxone, medication that can reverse opioid overdoses in the community. It is important to note that Mobilize AZ is not just a monetary investment. We will also be working directly in our communities and leveraging our collective knowledge base to expand resources. I'd like to share a few examples of how our program will make an impact. We are going to mobilize the compassion and dedication of our 1,500 employees statewide to volunteer their time in educating Arizonans on substance abuse and the resources available to them. Secondly, we will continue supporting doctors and nurses and the greater healthcare community in balancing pain management with addiction prevention. This aspect is paramount to Mobilize AZ. We believe people who are recovering from surgery, suffering from diseases or chronic conditions should have the pain relief that supports their quality of life. And one final example is expanding treatment resources through the medication-assisted treatment, telehealth, 24-hour triage, and removing barriers to opioid misuse treatment for our members and all of Arizonans. Each one of us can make a difference, whether that's knowing how to help to prevent misuse, asking for help, supporting a loved one, or taking an active role in treatment and recovery. I truly believe that by standing together, we can save lives. And now it is an honor and a great pleasure to introduce Governor Doug Ducey. In his first term in office, the governor has led a number of major reform initiatives to benefit the state. One of note is the recently enacted Arizona Opioid Epidemic Act, aimed at fighting the opioid crisis, which claimed the lives of more than 1,500 Arizonans in the last 13 months. Welcome, Governor Ducey.
Thank you. Thank you very much. And Pam, thank you so much for the invite. Woody, it was so great to meet you earlier this afternoon. From June 15th of last year to August 2nd of this year, there were 1,544 suspected opioid deaths in Arizona. 1,544 precious lives claimed by this scourge. As Pam mentioned, an average of nearly 4 people every single day. That's why Arizona has taken immediate and aggressive action against this crisis. First, with a declaration of emergency in June of 2017, followed by the passage of the Arizona Opioid Epidemic Act in January of this year. One of the most significant components of this bipartisan model legislation was a $10 million investment to help uninsured and underinsured people get the addiction treatment they need. Today, Blue Cross and Blue Shield of Arizona has reaffirmed their commitment to partner with the state and fight the opioid epidemic in a tremendous way with the launch of Mobilize AZ and a $10 million investment of their own. I want to thank Pam and the entire Blue Cross Blue Shield family for stepping up in such a significant way. Pam was incredibly generous with her gratitude and appreciation of me coming here today for the press conference, and I let her know I will come visit anytime she has a $10 million investment for this cause. This organization has long been a champion of public health in our state, and I applaud your investment and dedication to winning this fight. While Arizona's formal declaration of emergency has ended, we all know that this battle is far from over. Our bipartisan legislation and new policies are now in effect. And with partners like Blue Cross Blue Shield by our side, our efforts are only gaining strength. And I want the rest of the business community to hear that as a challenge. We're holding bad actors accountable, ending pill mills, and providing the tools and resources medical professionals, law enforcement, and treatment providers needed in order to save more lives. We're facing this epidemic head-on, and we're doing it while showing compassion to those who struggle with addiction and suffer from ongoing chronic pain. Just a few of the many signs of progress that Arizona has already made. Between June of 2017 and June 2018, the number of opioid prescriptions filled is down 40%. And the number of opioid pills dispensed is down 43%. Also, since June of last year, 1,000 law enforcement officers have been trained to administer the overdose reversal drug naloxone. These officers have treated over 400 people with naloxone, and in all but 9 cases, the individual survived the immediate out-of-hospital event. None of this progress could have been made without the collaboration and partnership of so many people in this room that have joined us here today. And with Arizona's continued partnership between medical professionals, law enforcement leadership, treatment experts, community leaders, and elected officials from both sides of the aisle can continue to make this difference. I'm thankful that we have such a dedicated leadership organization and partner in Blue Cross Blue Shield of Arizona that is devoting resources and ingenuity to improve the health of our entire state. And I'm confident that by continuing to work together, we will save lives. Thank you.